question. What is this breakdown by age? How many are youth? How many are middle onset? How many are late onset? Just roughly.
With FSH.
FSH.
Oh, that's really hard. That's really hard to say, and so I really can't say, because it's a lifelong disorder. When you say people with FSH, I think you're meaning people who have a disability.
Recognized.
Yeah.
With or without official diagnosis, but
I would say that it follows the same demographics of our general population.
Okay, what's the general population? You just mean...
I'm passing on that one.
You mean the total population?
Yeah, I would say that FSH just follows our demographics. So if we have 1/3 the number of adolescents in our country as we do young adults or older people, then it would be the same.
Is there a time frame that is, how do I say it, where it affects them the most, unfortunately? Like, we've all heard puberty is when it usually hits starts. Is that?
So in terms of, could you repeat the question? Oh yeah, sorry. So the question was, is there a time frame in which FSH hits the most? And so I think that your question is when does it impact you emotionally the most? And that may be true. Certainly there's a wide variety, of course, we know that with FSH, but if we take sort of the most common presentations of FSH, then the most common presentation is to develop some weakness, some disability in adolescence. And up to that time, a child may have noticed that they were not as strong as other kids, but it wasn't as big of an issue. And beginning in adolescence, there may be a separation in which one feels that, okay, I'm not the same physically, and that comes at a time when every adolescent, boy, the only thing they want is to be the same as everybody else, and not just stick out. So yeah, I would say that in general, adolescence and young adulthood is the most difficult time for someone emotionally, for someone with FSH.
Rebecca, do you mind if I ask you a question?
Certainly, yeah.
How did you overcome those challenges in teens/college years with socialization?
An interesting question. I was diagnosed around age 11, and my mother had it, and to me, my mom is like my idol. I look up to her in every way, and she's just an amazing person, and she's got a pretty serious case of FSH, so I always noticed that she was different. And so when I was diagnosed at age 11, I was like, okay, I'll just be like my mom, that's fine. And it didn't seem to bother me too much, and I started growing up and noticing the changes, noticing I could lift my arms very high, and that my physical outlook was a little bit different from other people, and I just didn't want to let it affect me or let it get to my head. I'd like to be a very positive person, and when I started noticing those changes, and I was like, well, I guess I just won't be a professional basketball player, that's fine. Stuff like that. So, and overall, I've always enjoyed going to the clinics and meeting people like Dr. Wagner, who make me feel pretty darn good about myself and about my prognosis and stuff like that. So, yeah, I would say I had it, and it was tough, but overall, I don't think it affected me horribly emotionally. I think it actually just made me a stronger person in general. I hope that answers your question.
Thank you. Anybody else?
I'd like to comment on that. Boy, that question is a $1 million question. She asked about what age does it affect you. It starts to manifest itself when the person allows it to manifest itself. In my case, I chose total denial as Lillian did. You don't tell your friends, you don't tell anybody, you just basically use denial. Whether that's the best way to do it, with me, it manifested itself psychologically at an older age. when you look back on it and what it is get to you and how you've progressed in that life. So that question is just really can't be answered. I mean, it's individual, and I believe the health in the psychosocial area, I think, is very important. I didn't have that. I've seen Dr. Wagner for 20 some odd years, and I think it's only recently, I don't know the exact date, but that you started implementing the sort of the psychosocial aspect of it, because you know, you need somebody that understands the disease and understands what they're going to be up against, and they, you know, don't always necessarily want to hear it from the doctor. You know, they want to hear it from someone else who maybe has had the disease or knows a lot about it, that can help guide them psychologically through that.
Well, I think that you've brought up some really excellent points, and if I could try to address some of them. So you're right that physicians need to address and don't always address the psychological aspects of this disease. Or let's say the neuromuscular physician. They think that that's somebody else's job. And maybe it is. Maybe they're not the best trained person, but they need to assess how the patient is doing and perhaps make the appropriate referral so that person is getting support. Because you're not going about your life talking a lot about FSH. And one of the times you really do talk about it is when you come to see the neuromuscular physician. So that's a really good opportunity to try to assess what the needs are and address them.
Question from the audience online is, you know, FSH has this duality. It has a large preponderance of those of us with FSH in the family, which has maybe one way of addressing sort of coming to grips with it. But the question from the audience is, any advice for coming to grips with FSH when you're the de novo, when you're just out of the blue, new mutation in the family?
Is there anybody here who wants to volunteer being a de novo?
No, but I'm just throwing out support groups as alternative family supports. It can be invaluable. Just finding others